Welcome to the Maine Senior Games May Wellness Event. I would like to ask you, if you haven't already done so, to please mute yourself. And you can be participating in this Zoom call with your video on or off. That is doesn't make a difference
Mine
to
is
us
right
here.
Or never mind.
We do. I will monitor the chat box. So if you have questions along the way,
Can I see the computer for a second?
we're going to do this in two parts, and Betty DeSisto is going to do the first part, and we'll offer an opportunity for you to ask questions after that. And then Justin Lucer will do the second part, and then we'll let you ask questions. And then Joe Dill will have some comments and feedback regarding the process that we have set up for the Maine Senior Games. So thank you so much for attending. I'd like to introduce Betty to you. Betty DeSisto is an RN and is currently working at the Maine Medical Center as a nurse epidemiologist. She has specialized in infection prevention for the past 6 years. Through her diverse 30 years in nursing, she has become highly motivated to contribute to continuous quality improvement for patient safety. Betty, welcome. Thank you so much.
Thank you, Deb. Thanks for letting me be here with you guys tonight, and for taking the time out on this evening to kind of, continue, your events for your wellness evening. So this is a great opportunity that you guys give to everyone to have this. So hopefully I'll give you a little bit of information about COVID, and hopefully you'll gain a couple things that you haven't already known. And that will help you emerge safely as hopefully this pandemic ends, right? So the COVID-19 story, and we know in 2019, in December, things started to unfold in China. I was kind of watching it from our, reading the news, and because of my interest in epidemiology. And then in January, Maine Medical Center, we started preparing for the possibility of the virus coming to Maine. Personally, we all have a COVID story, and my COVID story, in February, I started preparing my adult children for the fact that I really thought COVID-19 was going to come and it was going to change some things in our lives. And I had my adult children start stockpiling some items that I thought might help them get ready. And then March 1st, I called my first ever family meeting, and I kind of said to them, do you want to shelter in place in New York City, or do you want to come home? And they had said they wanted to come home. And on March 12th, I called the girls again. I have 3 daughters. And I said, you have about 2 days to get out of New York City.
March 12th is the day we were in New Jersey.
I think New York is going to close down. My 3 daughters came home with boyfriends, and my house of 2 quickly went to a house of 7, and they stayed for 10 weeks. It was quite an interesting time. I was the only one that left the house during those first 10 weeks. Everyone else worked from home. And I called it correctly for my daughters in New York. They came home, and 2 days later, after they left, New York City closed down. So we all have different experiences from this COVID thing. Some have been positive, some are negative, and then some are okay either way. But who knew Zoom would bring us all together so much now, right? So my presentation tonight, I'm hoping we can talk about the COVID variants a little bit, explain a little bit about the effectiveness.
Oh, Betty, you are frozen. Okay. Is Betty frozen on everybody's screen? Give me, yes.
Oh.
Yes, Betty, you froze there.
Okay, but I'm good now.
Slide.
Okay,
Okay.
she's good.
Sorry. And I'm going to talk about the chain of transmission and how we can break that chain of transmission and emerge back into society. And then hopefully you'll leave with a couple ideas. So we know in December 2019, it was first identified in Wuhan, China, and how it how it got there, how it started is, if you watch the news, it's always changing what it is, right? If it's from the bats, or are we thinking it's really from the lab? Hopefully, eventually we will actually know. About a month later, the World Health Organization declared it's going to be an international concern because it is human to human transmission. And then February 11th gave the COVID-19 that we switched it to COVID-19 to kind of shorten the name. It was 2019 novel coronavirus outbreak. In March 12th was our first case that came to the state of Maine, and our first case at Maine Med was March 16th. So that is a really short period of time for something to start in China and to get all the way to our state of Maine. And I think that's how you're going to see viruses now rapidly moving through. Coronaviruses, there's a large family of viruses that are common in people, and they come from different species, from bats, cats, camels, cattle. It can spread very easily. This particular one is easier to spread than the common influenza, but not as effective, doesn't spread quite as rapidly as measles. The problem for this one was that our immune systems were not used to this particular virus. It was new. Our bodies didn't know how to react to it. And we've had other coronaviruses around. We've had the SARS in 2003 and the MERS in 2012. None of those seem to move around and quite transmit quite as quickly as the COVID-19. But we also travel a lot more than we used to back, in 2013. Viruses constantly change through mutations, and new variants are always expected. That's the same with your influenza shot, right? Your influenza shot, each time you take the shot, if you take it each year, it actually is covering a couple different types of influenza virus because they change what they think is going to come around in our area. So that's not new. We would have expect this to change and have many different types of variants. Certainly the scientists are watching these variants, because as a variant changes, viruses are smart. They want to multiply, right? So they're going to learn how to change and how to adapt and transmit a little bit faster. So one person said, if you think about a virus like a tree growing and branching out, each branch on the tree is slightly different than the others. These small differences have been studied and identified since the beginning of the pandemic. Some of the variants are the B117, that was initially declared in the UK. B1351 was in South Africa in December. P1 was in Brazil, and you can see there were others in California. So where are we right now for the number of coronavirus cases? I think the slide came in a little earlier, but I think this was started in December. So you can see back in December, and this is December and January this year, and where we are now. So we've had quite a difference of changes, right? I put the slide up 2 or 3 days ago. So we've had a 20% decrease since last week in the number of COVID positive cases in the US, and 89% decrease since the highest peak in January. So we're making great strides. Variants, these are all the different types of variants we have in the United States starting since January. So you can see that there are more than just 1 or 2 variants. There are numerous variants that we have. And this on the CDC, if you like looking at the CDC, it kind of breaks it down by region and how many different variants that you have. So if you can see up in the right-hand corner where Maine is, New Hampshire, they kind of clumped us all together with Massachusetts. You can see the pie chart shows there's quite a few different variants. And this is certainly the world where there's more than 1 variant. So there's numerous variants throughout the world. Some of the areas in white probably do not test for variants. So what do we do? So these variants, and they're always changing. We have to change how to break that chain of transmission. This is what we use for epidemiology always. And how to stop anything, say it was the flu, is how do you change some of these pieces on here? So I put a kid-friendly chart up because I think it's nice to sort of see this one. We have our agent at the top, which would be our virus, right? We have where the germs live, it's in people. How the germs get out, your portal of exit. For the COVID-19, it's going to be from coughing, right? It's a droplet, it's airborne. How it gets around. When my kids first came to my house and I would go grocery shopping, they boiled every single thing and wiped down every piece of groceries because we thought it lived on the environment. It doesn't, the mode of transmission isn't so much on touch, but if somebody respiratory coughs into their hands and then touches the doorknobs, you touch the doorknob and then you put it up to your eyes, that's the mode of transmission. The portal of entry, how does it get into us? And then we have another sick person. So how do we change these pieces so that we don't pick up the COVID virus, right? So we know if we're around somebody who has COVID-19, it gets out by them being in close contact within 6 feet, them coughing most likely, or them coughing and touching something that we then go and touch. So the mode of transmission can be on contact or droplet by being in that same breathing area. So this is the mode of transmission is our best way to stop this from us picking it up, right? Why we did mask was to help the portal of exit, right? We put the portal of exit on us so that hopefully we wouldn't be coughing it out and transmitting it to someone else. I want to talk a little bit about the vaccine effectiveness. This was updated from the CDC on the 14th of this month, that it's all the vaccines are showing a 94% effectiveness. That's pretty high. That's really high compared to a lot of the other vaccines that we take. This recent study that they did, it was from 33 different places and in 25 different US states. I think they had over 1,800 people that they studied on this. And it really gave the science to show, okay, we can start backing off on all the restrictions that we have, right? We can start opening up, and that's why they've opened up. There's always a debate, have we opened up a little too fast? But either way, I think this study is what's allowing us to open up. What does it mean to be fully vaccinated? It means that you got your doses. You guys probably already know that, and that you waited 2 weeks since your dose. So if you've chose to get a dose that's only one, it's 2 weeks after that. If you're getting the two-dose vaccines, then you're waiting, you got to wait for those 2 doses and then 2 weeks after that. Then they kind of consider you're fully vaccinated. Do we need a booster? That's what they're trying to find out and identify. I think the latest information is they think we might need a booster, but it would be 1 booster. But they also are seeing that maybe this, at first, they thought we were only going to be covered for a few months. Now they are thinking that we're going to be covered for a year, which is really great news. So if you're fully vaccinated, what are you allowed to do? The CDC is saying we can go outside without mask. We can go into a workplace, unless of course you work in the hospital. It's been very strange for me to walk into some of the grocery stores and see half the people without mask. I'm so used to seeing the mask. I'm having a little bit of anxiety when I see that person without the mask, and I'm stepping.
Oh, Betty, if you can hear me, you are frozen again. Betty, can you hear me? Can you? Okay. Betty? Okay, folks, hang in there. Let's see what she did. She may have had to up her, go back in. And hopefully that's what she's doing. So hang in there.
Deb, while we're waiting, do we have any questions or anything?
The only, Bonnie, I have, yeah, no, it was just asking Betty to refresh her screen because when she got frozen. And then you had asked, I think, something about one of the maps, if it was Maine, it was about Maine, or if it was the United States.
Yeah, that was the first one.
Oh boy, I
Chris.
wonder. So let's give her some time here, see if we can get her back here. While we're waiting for her, where she was at in her presentation was about some of the anxiety that she's feeling as far as going in the store and having people not be masked. Anybody care to share? Anyone having experiences like that happening right now with this change that you want to talk about?
Well, I went to the supermarket today and experienced that exact same thing. The
Okay,
workers had masks on. I had a mask on, and probably about a third of the people had masks on, so it felt uncomfortable.
it did. Okay.
Yeah.
Did you guys move on to a new one? Someone else?
Okay, Betty, you're back. Okay. Can
Um,
you pull your screen back up there?
Yes, I can. Sorry about that. I changed
okay.
internets. Hopefully that will help.
This happens, right?
Yep, it's happened quite a bit.
So you were just telling us about going to the grocery store, people without masks, I think.
Yes.
Let's
Can
see
you
if we
see
can
my
get-
screen?
Yes.
Okay. So they're saying if you're fully vaccinated, what you're allowed to, you can resume domestic travel. You don't need to quarantine after, and you certainly can. I think did they allow international travel or some international? I think they might have. It changes so rapidly. But yes, you after a known exposure. If you've been in contact with someone that has COVID positive, one, just because you're vaccinated, I would not suggest you going and staying or visiting with somebody who has COVID. It doesn't mean you're not going to get it just because you're vaccinated, but you're certainly at a lower risk. Now I have a plane, like, so the things they say you can certainly do your indoor gatherings with other fully vaccinated family. You can go outdoors now, which I think you should have been able to go outdoors before, but you can dine outdoors or indoors with different people. And now I believe the Bruins are playing with a full house on Saturday night, if I think I've heard that correctly.
Mm-hmm.
And you can participate in indoor high intensity exercise classes. You can go back to church, you can go to museums, you can do all those things. But just because you're vaccinated, you still can catch COVID-19. They do have some vaccine breakthrough cases. I have seen some patients with it. Certainly it is a lot less than if you didn't get the vaccine. And the majority of the time, if you do get it, you're going to have a milder case of it. And with a milder case, we're thinking you're not multiplying this virus and you're not going to be able to give it to other people. So I haven't really seen that where you were fully vaccinated and that you gave it and you were the first person in your household to get it and you gave it to your spouse or your other family members. But I have seen people who are fully vaccinated picking it up, and occasionally there's been a couple that have actually been ill from it and had to be hospitalized. But our rate is significantly lower than before we started.
And he was fully
Am I
vaccinated.
frozen again?
No,
No.
you're good.
Okay, good. So in the, I just wanted to, for playing sports, I think we can go back to playing sports, be a role model. If you're going to go out and do stuff, I would hand hygiene, right? It's that mode of transmission. Don't be touching all kinds of equipment and then touching your, eating the bag of chips and then, or rubbing your eyes or licking your fingers from a great chicken wing. Hand hygiene, right? And that's always with most viruses and germs. In the beginning, this is from the CDC. I think they haven't really updated this as much as they should have because it looked like the date was back in December. But they say certainly focusing on doing some of that distancing. So focus on building up a lot of your skills, but maybe not in a tight group, maybe being further apart. Be outdoors when you can. Indoors, when it's raining out. And if you are indoors, I still think, opening the windows and the doors if you can. Make sure you have that good circulation of ventilation. As with anything, you're going to cover your cough or sneezes, and wash your hands afterwards. When I say wash your hands, it's soap and water, or certainly, but any of those alcohol hand sanitizer. And, I still think you should be cleaning your high touch surfaces, because on that mode of transmission, if someone has coughed into their hands and then grabbed, the doorknobs or, the locker or, drinking fountains, if they have any around, the mats that you might use, you're still going to want to clean those off. But I wouldn't say that you need to be quite as concerned as we were in the beginning of the virus, but you still want to wipe those down. If players have their own equipment, have them bring their own stuff to share some of it if you can. And certainly, as with anything, sharing water, the same drinking water or utensils, try to avoid that as you would with anything. And I think still, if you're having a buffet, think about how you're serving that up so that not everyone is grabbing all the same utensils. Maybe have one person serving everybody up. And, certainly, again, watch they call it your T-zone, any of the moist areas of wiping your eyes, touching. And that is my little presentation. I'd love to take any questions if you have any, and make sure that you're washing your hands.
Oh, thank you, Betty. Can we, unshare your screen, please? And does anybody have any questions or feedback or comments for Betty about where we're at, where you're at now with what we're doing to pull ourselves out of this?
Eddie, this is Susan Starbird. I'm concerned still. My husband and I are only children, and we have parents that are 86, 91, and 93. And, maybe I'm being too cautious, but I'm just very nervous about going into places with other people and so on. What's your thoughts on that?
I think you're right. I mean, you do want to be mindful of that. So if you're going to go and visit, I don't know if you parents all the time, but say you only see them once in a while, think about the number of people you see before you go visit them. And remember, the transmission is for you to get somebody else. Normally you're going to pick it up, you'll know 5 to 7 days after you've been there. So
Right.
if you want to go to a big concert, you're going to some concert with lots of people in an enclosed space, you may not want to go visit your parents 5 days afterwards. You may want to
Right.
give yourself a little over a week to make sure that you don't come down with anything.
Yeah, I'm
So
not,
I think
yeah,
think
it's common sense pretty much, but I'm even nervous about getting in big crowds and so on. I'm just kind of, not saying I'm a scaredy cat, but it's just a lot to take in.
it is. It is. As I said, I'm surprised that I was kind of nervous when I saw people without their mask on in the store, and I know I'm not even near them, but for me, it still took me back a little bit. And I think that's why this is going to be great that Justin's going to talk about some of this on the second half of this. How do we deal with that? How do we give ourselves permission to go back out in society and not feel guilty about everything that we do? I think I've been out to a restaurant maybe 3 or 4 times, and I kind of feel guilty afterwards. And I know I'm not right within close contact with other people I've gone to dinner with, and the waitress was still wearing a mask, and I wasn't within, the person next to me that I didn't even know wasn't that close enough. But, I think it's taking it in small steps at a time.
Yeah, I haven't eaten in a restaurant in over a year. I have no problem with takeout, but I'm nervous about that. And I think a lot of restaurants I heard this past week have gone back right as it is, how it was, taking all the plastic down and no
Yep.
sort of distances or anything. So,
If you're going to go back your first time, you may want to do something like picking somewhere where you can eat outside first.
yeah,
So you're outside, you have a lot of ventilation, or if you have to go inside, you try to get, some restaurants have like a window right there that's going to be open, or a half wall.
yeah,
Try to get one of those first. Kind of allow yourself to enjoy being able to go out and not being so nervous, but also making sure you have great ventilation so you don't have to worry as much.
okay. Thank you.
Susan, this is Cynthia, and I'm with you 100%. I on my way home today, I stopped at Hannaford and Scarborough, which I shop at. And I still wear my mask. I still hand sanitize. And I walked in, and I'd say there's 50% that were not masked, and there was a big majority that were. And this is my take on it. This is what I'm going to do, because I run my own life.
Right.
I'm going to wear my mask for as long as I need to until I feel comfortable.
Yep.
That is what I am going to do. I don't care who. I got into a big fight yesterday. A customer came in, a client, and I do closings, residential closings.
Right.
And a realtor came in and no mask, said, I didn't get my shots. And I said, okay. So I wasn't happy. I wore my mask. I made them all hand sanitize. I opened the windows.
Good.
And I was like, you know what? That's your prerogative, but I'll tell you something. I did get my shots, and I'm proud of it.
So did I.
So you got to let people not intimidate you, and you need to do what's good for you and what you're comfortable with. And I don't care if they say, oh, no more masks. Oh, you can do this. You can. It's going to take me a long time.
I think me
until
too.
I'm ready. And guess what? Nobody's going to tell me any different. Right, Deb?
You got to go along with that, Cynthia. Thank you for sharing that.
And I think this is a good segue into Justin, because we've asked him to talk about this. And I think you have to let yourself feel the way that you feel and figure out how you're going to deal with it. So,
Justin, I didn't mean to take the show away from you. Go ahead.
that's okay. So Betty, thank you so much for all of that. I hope you can stick around with us here for a little bit.
Well, absolutely. I would like to hear what Justin says.
Okay, our next panelist is Justin Lucer. He's the Marketing Director for Behavioral Health for Frisbee Memorial Hospital, Parkland Medical Center, and Portsmouth Regional Hospital. Justin oversees operations for 3 inpatient psychiatric units, 2 partial hospitalization programs, and an eating disorder clinic in Salem, New Hampshire. Justin, welcome and go right ahead.
Hi, thank you very much for having me. Can you all see my screen?
We can.
Oh, great. It's been quite a pleasure the past year and a half with all these Zoom calls and everything. So I'm happy you can see it. So thank you for having me. My name is Justin Lucer. So I'm the market director for the behavioral health service line for 3 hospitals in New Hampshire. This just kind of gives you a brief sort of overview of what the services we provide are. We're the second largest adult inpatient psychiatric provider in New Hampshire, which isn't saying much. We don't have a lot of behavioral health in New Hampshire, and we're a small state anyway, but we are proud. I am also used to work closely with Donna and Bonnie, so I'm really happy to be at least virtually connected today with them as well. So anxiety. The picture on the left is just talking about anxiety in general is my worst nightmare. So I don't know, I haven't been to a Barnes and Noble in a long time, partly because of COVID and partly because the internet. But I don't know if any of you have been to a Barnes and Noble, but they have this ante room. So when you go in, you have to open one door, you walk through metal detectors, and there's a second door that you open there to get in. And I don't know what it is about Barnes and Noble in particular, but it will take me a couple minutes just to get in that door, just because for some odd reason, which I know sounds completely crazy, but is in line with some type of anxiety, I feel like I'm going to open that door and be stuck there waiting as people are going in and out. So it kind of makes me sort of anxious. And the reason I'm just presenting that is everybody feels anxiety. There are little dumb things that we get anxious about, and then there are bigger things that we get anxious about. Largest being money, interpersonal relationships, work stressors, public speaking, presenting on a Zoom call. All of these things can potentially make us anxious. Anxiousness or anxiety is actually one of the larger admissions to an emergency department. So, I mean, it can progress to itself where you feel like you're in chest pain and you feel like you're having a heart attack. And that's a real thing. And people often come into the ED feeling they're having a heart attack when really they're responding to anxiety. And it can compound itself, right? So specifically around COVID, you start to think about all sorts of things, and it really can magnify itself at night. So for example, you can start to think about, for me, I could be like, oh, I might get furloughed or laid off, and then what am I going to do? How am I going to find work? How am I going to pay my bills? I'm going to lose my house. I'm going to end up in a homeless shelter. Like getting yourself to really worked up to the point of unreasonableness, right? So that's kind of how anxiety starts and presents itself, but it can progress pretty rapidly, as many of you may be aware. What's different about talking about anxiety and COVID is it's not one thing, right? So you're not worried about one thing. We've had to adapt and change almost daily at some points, receiving different news, from what we should do, where COVID lives, all of that. The largest fear of getting sick, being isolated, financial stressors a lot of people struggled with, bereavement, so that's a whole category unto itself. We have not been able to get together and grieve together if we've lost a loved one. Conversely, we've not been able to celebrate important events, so marriages, family reunions, family dinners, all of those things. Good conversation around wearing or not wearing a mask. I mean, I was in a gas station just yesterday wearing a mask. I work in a hospital, so I'm just sort of accustomed anywhere I go to having a mask on. And the gas station guy was like, hey, are you vaccinated? And then you don't need to wear a mask. And I was like, all right, well, I'll do me. You can do you. I think I'm going to prefer to be on the safer side in public. So I really appreciated, all of your points around that. Returning to work, I know a lot of people are anxious about that. We're seeing a lot of people in outpatient clinics starting to return to work. And what are the concerns are around there? Getting groceries, lack of human contact, social distancing, going to the doctor, all of these things can create significant stress in this time. There's 9 million other things that are anxiety provoking around this pandemic, but I think these are some of the bigger ones that really tend to perseverate our anxiety. So I'm not going to bore you too much with bar graphs, but I did want to look at this. So this was a study done by SAMHSA, which is the Substance Abuse and Mental Health Society. I'm blanking on the HA, so I apologize. But what we have seen is a significant increase in all mental health illnesses and symptoms, and an exacerbation of that over this period of time. Hasn't been a ton more data that's come out, but as you can see, it's a sharp increase. From where we started in March when COVID first started to hit, and we were seeing that, to August, where people really, this was sort of the timeline where people started to really feel the effects of social isolation, and the fear of getting ill. More people are seeking treatment for anxiety. As you can see again, that uptick in sort of people looking for help around managing some of those symptoms. And COVID has presented itself pretty severely around people who struggle with mental health. People who don't have mental health issues started to have some of those things, and it's really impacted that. And unfortunately, what has doubled that anxiety is a lot of these outpatient practices where people seeing therapists were closed. So people had to figure out how to navigate that through Zoom calls. And, as somebody who's been in the mental health field for about 20 years, there is a real need if you're in therapy or meeting with a doctor to have that personal connection, to be face to face. And that's a lot harder when you're sitting across on a video camera. Same story with depression screenings, which depression and anxiety are two sort of mental health illnesses that go hand in hand. As people are more isolated, they can't get out, can't go and enjoy the things that they used to enjoy. That depression creeps up, and we've had to really adjust our world into how we interconnect. And I'm not somebody who's great on the phone, so I've had to adjust and be better in terms of picking up the phone and talking to people, and really taking time to schedule Zoom calls with friends and family. And as awkward as that has been, it was very important for me to keep up those personal connections, so I didn't sort of let myself be enclosed in that bubble. So I know this is a little bit bleak, but we've definitely seen an increase in people thinking about self-harm or suicide, during this time. Not unrealistic. So if you are someone who struggled with depression in the past or struggled with some of these thoughts, now you're piling on a, nationwide, worldwide pandemic, some of those thoughts tend to creep back. And thoughts of self-harm and actually acting on self-harm are very different. It kind of comes down to a sense of control. So when everything's sort of out of control, we revert back to the idea like, well, what can I control? And sometimes when it seems really out of control, that's all people see that they can control is staying alive. Lastly, just in terms of, this is the last bar graph, I promise we'll move on to much more fun and exciting things in the next slide. But I just thought that this was interesting. I don't have a whole lot of insight into some of this stuff other than the newly expecting mother, that all of these populations had seen the biggest rise in depression and anxiety during the pandemic. Look, more exciting stuff, I said. So this is my family. On the right is my brother-in-law, Jay. He has a personality just like he looks. He's very jubilant, very cherubic, super nice guy. The next is my sister in the flower dress. She's very smart. She's super smart, intelligent, very successful middle school administrator. I can piss her off like nobody else. For some reason, I rub her the wrong way all the time. I love it. It's one of my favorite things to do. But we are like two peas in a pod. We're very close. My wife, Julie, is next to her. The little boy in front, his name is Peter. That's my nephew. And the girl, her name is Ruby. She's straight evil, just manipulative, but my favorite person in the world. I have the most fun with her. And then getting to the crux of it is my mom. So my mom is a Irish Catholic nurse. So I'm not sure what that's supposed to tell you, but I'll tell you this is certainly that she would take care of me in the winter if I was sick, and then also say, well, Justin, maybe you should have worn your coat outside. So caregiver, and lays on that nice thin level of guilt, you know. So, but again, my mom is one of my favorite people. So why am I showing you this and explaining to you, all of you being strangers, my family life? Just as an example of my mother really, prior to COVID, struggled with severe bronchitis and pneumonia, and it kept her bedbound for about 60 days, and she was really struggling, couldn't get out of bed, just difficulty breathing, and started to really, she takes care of my niece and nephew during the week, which she loves, takes them to all sorts of places. All of a sudden she didn't have that, and then COVID hit, and she really struggled. So she started to feel better. Her anxiety, which my mom does not have a history of mental illness. She's super social. She's involved in a large women's singing group, goes out to eat 4 to 5 times a week with friends, just super social. And all of a sudden she lost all that. And she really, really had a hard time, to the point where she was waking up. Because she's a nurse, she had access to a level of healthcare knowledge that probably isn't super helpful. So she started taking her blood pressure all the time. Would call me at night. We took her to the ED 3 or 4 times because she felt like her levels were all off. And you know, it got really concerning because it was just so far away from the person that she is. And I'm telling you this just to illustrate that this has sort of touched us all. And for my mom, who was sick and had been in the house for a while, and to have to do that again, and then that fear of getting sick, she really needed a lot of help and supports. You know, so we got her the help that she needs. She's doing great now. No, so it's not a bad story, but she was able to manage those things. But it became crippling enough for her that personally it touched me, to say, like, you know, this isn't great. You know, this is not good for people who had an active social life and who recently retired, and now that's sort of taken away from them. But again, she is doing great, but it was one of those periods of time where that, you know, that illustrates how crippling anxiety can be, and how fearful people can be over real fear. You know, there's a real fear of this virus. So you don't have to lean in and read this too much, but there are 2 modalities of treatment for anxiety. There's three really. There's a psychopharm piece to it as well. But cognitive behavioral therapy is sort of the standard. That has been around forever. We won't dig too much into the specifics of CBT and DBT, but I'll tell you this. So it's sort of looking at your emotions, your thoughts, and your behaviors, and how those affect everything. The best sort of example I can give to you around this is road rage, right? So I was commuting in Massachusetts for a long time, so I certainly can understand some part of road rage. But if you're driving along, you know, downtown or Route 1 or wherever you may be, and someone cuts you off, you get pissed off or upset and around some of those things, and just so angry. Then you both pull in the supermarket at the same time, and the person gets out and says, "Oh, I'm sorry. I really didn't see you. I'm really apologize," and really apologetic. Like, you realize that, like, your anger that you were admitting, you know, came from a behavior, you know, some thoughts that you were having about this person, that they're rude and they cut you off. You know, so it's really looking at, like, how your emotions affect your thoughts. You know, so if you're in a bad mood in general, your thought is going to be like, well, this guy just cut me off, and then I'm going to react like this, so I'm going to come and yell at him. When in reality, you have to sort of step that back, almost like a math problem, and be like, okay, why am I getting upset? What is the purpose? Why am I feeling this way? And are those things appropriate? So that's sort of been CBT has been a standard in therapy for a long time, but I think it's also, it's very effective in terms of the fact that it's very brief, it's very focused on certain issues. So if you're going to see a therapist about grief or loss or anxiety and how that's affecting your everyday life, they are going to target those things that are in front of them. So it is not therapy in terms of lying down on the couch and talking about your infancy. It is treating the then and now and the problem that's in front of you. Dialectical behavioral therapy is a therapy that is an offshoot of CBT, and DBT focuses more in on very, very individual moments. So it drills down even into the smaller thing. So when I'm feeling this way, I do X. Why do I feel this way? It is done through a lot of worksheets and really a lot of reframing the way you think about things and the way you respond. So this therapy has been the therapy of choice to deal with any type of personality disorder. It's not to say that you have to have a personality disorders to participate in these techniques. These techniques are very useful, and we'll dig into some of the more specifics around there. But both of these therapies are generally looking at anxiety like a math problem. Why am I feeling this way? What is making me feel this way? Am I reacting appropriately to that? And what's the worst that can happen? And when you can spell it out and really practice these things, it really helps you understand where that anxiety is coming from and how you can start to address it. So here are some of the bigger tech. These are really broad thoughts on DBT and CBT. So if you have specific questions, I'm happy to go into them. So radical acceptance. This is very hard to understand, but very hard to practice. So the basically is, this is happening to me. I'm stressed out about it. So what am I going to do about it? Here are my options of what I can choose. So you accept the situation that you're in, and then you start to move from there. So being anxious about going out to eat, all of those things, you can come up to, you understand that like everyone is in this, and I have to accept the situation that I'm in. It's a little harsh, but that's sort of the starting point around it. So this happened to you. What are you going to do to feel better? Understanding that we're not alone. So I'm certainly very guilty of somebody who, when they get sick, that like, even if I just have a common cold, that I'm quite sure in my head at that time that no one has had a cold as bad as mine during that time, and I can't understand why that's happening to me, which I know is ridiculous. I'm just a big wimp around colds. But when we look at this pandemic and we've been so isolated, what really you have to maintain in the front of your mind is that you are not in this alone. There are other people out there who are stuck in their houses, who have lost, the freedom, lost jobs, all of those things. And I don't say that to make people reflect on their own, struggles, anxiety, or any struggles they've had around the COVID and say your feelings aren't valid. I say that because this is an unprecedented time, that we're all going through. And if we can keep that in mind in terms of the larger collective, you can better understand and sort of move forward with your day. Planning ahead, noting the steps to the stressor. So just using the Barnes and Noble as an example, like, so for me, and I am not this anxious about going into Barnes and Noble. I'm just going to stay on the example. So, you plan ahead. So how am I going to drive there? What's it going to look like when I enter the door? And really just sort of stepping each one of those things out. So in terms of what makes you anxious, how do you get to each step? It's sort of trite to use, but there's that 1990s movie with Bill Murray, What About Bob? And they say baby steps, right? So breaking everything down into just small baby steps to get to the end result. Staying present, really difficult to do, but it's one of those things of mindfulness that's very important. So it's even being able to put your feet on the ground, understand where you're at, take a deep breath, and acknowledge that you're okay for that moment, not to get ahead of yourself in your thinking. Being grateful. So my entire life as a kid, I felt like I just wanted a big, huge couch, a big TV, and a large bed, and that those three things would make me happy. I can tell you, they did make me happy. They still do. I also wake up every morning and I look at my big TV and I say, I'm grateful that I have these things. I'm grateful to be where I am. Grateful to have a loving family. All of those things helps remind us where we're at and helps keep us present. All helps like sort of reduce that level of anxiety. Obviously maintaining connections. So doing that, with family, scheduling time to actually meet through Zoom, or scheduling time to socially distance and meet, or scheduling time to go into a restaurants together. So even if you get up to the entrance and you feel like it's too much, you're not in it alone, right? So you have somebody that you can relate to and talk to around those things. Staying informed but not obsessed. The internet, cable news, all of it is a wild place with lots of varying different opinions and lots of different information. So it's really important to stay informed around COVID-19, but not to obsess about it, and to make sure that that you as an individual are finding the information that's most helpful to you and ensuring that it's realistic and sound. And the best way to do that is certainly through the CDC. And then doing the math. So figuring out sort of as like a math equation, why are you feeling anxious? What is making me feel anxious? Can I step that back? What is in my control? And looking at these things as like sort of a math problem. So if I do A and B, I know I'll get C. So smaller picture, obviously make and use your connections, find purpose in meaningful activities. So when we do get depressed or we do get anxious, one of the things that we tend to do is completely isolate, like lie in bed, watch TV, just really turn internal. What we need to be able to do is schedule those activities where we can participate in and they sort of bring meaning and value, and engage in practices to relax. So not a lot of people do this. It's a busy world out there, right? We all have different priorities and things, but we really need to schedule time to take a bath. That's your thing. Go for a walk. Find something that's going to help bring you some relaxation. Physical care, healthy eating, and exercise are all good sort of coping skills to use. Spending time outside, writing things down in a stress journal, or just writing things down in general. It puts it somewhere else, right? So if you can write it down and look at it, it doesn't have to live in you. And I know that sounds sort of very hallmarky, but those things sort of work. If you keep all of that in, that's going to increase your stress level. Which brings it to the second point, is verbalize what is making you anxious to others. We don't do this enough. Where I think we're on the physical front, we're always okay to say, oh, I'm having this pain, my back hurts, A, B, and C, this or that. But we really don't do a good job, and partially because of a stigma around mental health, when we're talking to people and we do feel a little bit anxious, saying, hey, I'm feeling nervous today, or I'm feeling anxious about these things. Because what we do get from that is good feedback from people, right? When someone else can say, I'm feeling anxious as well, that lets you put it to another place. And that also lets you go through it together. Obviously, poor coping habits, you really want to be careful around that. We tell sort of any one of our clients or patients coming in that not to abuse or use alcohol as you're going through one thing. Don't let something come in that's going to sort of numb you a little bit. Don't use it for those purposes. So to be mindful if you're going to have a drink with somebody, why am I having this? Am I having it to enjoy, or am I having it to sort of self-medicate? And then lastly, just seek professional help if need be. Another thing that we don't do that well as people is reach out and talk to people until it's a little, not too late's the wrong word, but you're too anxious. If you're feeling that way, I mean, therapists, psychiatrists, all of those things are good avenues to pursue. Lastly, I was thinking about this on my ride back to the hospital this evening, just thinking about hope and resilience, which I think gets thrown around a lot. I've done a lot of work on resilience, specifically in grad school. I'm really interested in it. And I think when you can step back a little bit, it's amazing. So as devastating as COVID has been, as stressful, we have adapted as people in a way that in my lifetime, even through 9/11, we've adapted in a different way. So we've changed things. We've altered, we've changed things right now. We're all in a Zoom meeting instead of being together. We've reinvented whole structures of business and how to work, stood up social networking sites. We produced a vaccine in under a year and rolled out those vaccines in a massive way. People supported their healthcare workers. They supported their local businesses. Things are starting to open back up. we supported one another in very hard times. And I think, like I said in the beginning, despite sort of the overall stress of all of this, there really has been a lot of good things that have come out of this, and that will continue to get us out of this. And it makes me very proud to be a human being. I mean, in terms of some of the ways that people have helped each other out during this time. I know we're just 1 minute short of time, but if I don't know if anyone has any other questions or anything that they'd like to ask or talk about and discuss in terms of anxiety and depression.
Thank you so much, Justin. I love the last slide. Ooh. Is there any, can you pull your screen down there, Justin, and we can
Yep.
see if anybody has any comments or feedback or questions?
I have just a comment. First of all, Justin, hello, and hello to Julie, and thank you so very much to both of you, and Betty. On that last slide, I'm really thankful that you put that in, because that whole idea of stepping back and looking at, first of all, we've survived, not everyone, but we who are here have survived all of this. And that kind of summary of what has happened in the last year really does produce hope about, we'll get past all of this and back into a regular sort of life. So pointing that out, I thought was very, very helpful.
I'd like to share, during this COVID, I lost my mother 4 months ago, and I lost a close uncle, my last uncle, and it was, hardly, a very limited amount of people that could go. And it just wasn't the same, finding the support that you normally would get from your family and relatives and friends. And one of them I wasn't able to go because because it was in Montreal, one of my uncles there. So, I think that compounds a lot for, like the grief, and also, with the circumstances, that we went through during that COVID. But it's really good to know that I had to reach out for extra help because, that support wasn't there. And so I'm just really thankful that there was I was able to reach out and get a little bit of help, just wanted to share that.
Thank you, Rob, for sharing that.
I think it's been, obviously it's been awful. And, I am certainly somebody who is not immune. I've lost a few friends to COVID, young folks. I think it's really important as we've gone through those things, to not only just reach out for help, but specifically around the grieving process is to find a space to grieve. So we've had things taken away from us, like we can't gather for funerals. And although some of that's coming back, that grief doesn't go away. And the idea of a funeral or any type of service, or even on the flip side, the idea of a marriage, right? So when good times happening, those were gone for a period of time. And those being like the primary ways of us to cope with things is to understand that grief's going to live there for a bit. So how do you work with others and reach out to people, not only professionals, but peers, to celebrate someone's life and their achievements? I think that's where, in some ways, we've done a really good job, even among hard times. But there is that extra need to be able to find those coping skills.
And I think, Rob, to that, and Justin, I think there's one big factor here, and that's guilt. I think that guilt is the number one thing, and Rob pointed it out, is because we couldn't be part of these things, because we couldn't be there for people. I know there's a lot of people right now walking around with major guilt, because they couldn't be there, or they couldn't do this, or they couldn't do that. And I don't think that gets put into the mix a lot. Do you know what I mean, Justin? It doesn't, it's the grieving and the sadness but I think the guilt is unbelievable. You feel so guilty that you couldn't go to the hospital, or you couldn't be with that loved one, or you couldn't be there for those people, your friends, your family. The guilt is just incredible. So But I do appreciate you sharing the things that you did. And I do see a light at the end of the tunnel. And I think that we're very, very strong, all of us. And I think that we've learned a lot through this, through COVID. We've learned a lot about humanity. And I do agree with that. I really do. I really do. And thank you for sharing tonight.
Thank you, Cynthia, for sharing that.
And Justin, I'm really smart too. Just had to say that. Deb.
Anybody else have comments, questions, want to share? Seeing that, thank you so much, Justin. We're going to wrap up here before we say goodbye to everybody. I had asked Joe just to share with you briefly the work that's being done as far as getting our games going this summer and giving some feedback about what kind of COVID procedures we're putting in place right now. So go ahead, Joe.
Yes, thank you. I'll be brief. I know we're running out of time. Just quickly, we had in January, we had set up a 10 things for our COVID guidelines that have been on our webpage. And we decided that in 4 months that most likely we hope things would look a lot different. So the Games Committee is going to review our present COVID regulations and most likely make some changes to present to our Senior Games Board. But that's number one. Three more things. Every venue and every facility that we use is going to be different and going to have its own guidelines. So for those of you that are either a volunteer or an athlete, if you know me at all, you'll know you have way too many emails as to what to expect when you get there, so that there will be no surprises. And I will, if they have guidelines, you will know them before you get there. Also, we wrote a grant and got accepted, and we have lots of product at each event. I know both of our speakers, who were very good, by the way, and thank you so much for sharing, talked about, PPE products, and we have all of those for each event. Everybody there'll be plenty. Everything will be wiped down and so forth. And then the final thing is we're watching the main CDC guidelines every step of the way, so that we will be on board. And as I said, these will change as soon as they change. A new one will appear on our website. The most important thing is to keep our athletes, volunteers safe. So thank you.
All right, thanks, Joe. Any questions for Joe? We are aware of everything changing, and we'll keep talking about it. So again, what's in place right now might not be in place come July and August and September and October. Betty and Justin, thank you so much.
Yes.
Bonnie, thank you for introducing us to them. It's been a pleasure to hear from both of you. Justin did put some contact information in the chat box. This recording will be available as early as tomorrow. If you as an individual want me to just send you that recording, you can email me. We will get it up on the website as soon as possible, which will probably most likely will be next week. So you will have access to it. So now, if there's nothing else from anybody, I would say again, thank you so much for joining us. Have a safe night, a good night, and a nice Memorial Day weekend.
Thank
Thank
you.
you all.
Thank
All right,
you.
bye-bye.
you.
Thank you.
Bye-bye.